Chapter 10, Teeth Arrangement, Extracted Notes. Pages 165 to 168. Introduction. Following the selection of teeth and determining the type of occlusion, the artificial teeth are arranged. Arrangement of teeth is dictated by setting principles of individual teeth, anatomical landmarks, dentogenic concept, ridge relation, need to arrange the teeth in balanced occlusion. The teeth should occupy the potential denture space or neutral zone. Factors influencing teeth arrangement. The factors, guidelines involved in arrangement of artificial teeth are 1. Anatomical landmarks, 2. Dentogenic concept, 3. Ridge relation, 4. Balanced occlusion, 5. Neutral zone. Number 1. Anatomical landmarks. Residual ridge. Maxillary teeth are positioned labial to the ridge. Mandibular teeth are positioned on the crest of the ridge because of the resorptive pattern of the ridge. Lingual cusp of the maxillary posterior teeth should be centered over the mandibular ridge. Mandibular anterior teeth should not be set too far from the center of the ridge to ensure denture stability. Lingual cusps of mandibular posterior teeth should not encroach on the pound line. Pound line is an imaginary line extending from the lingual border of the retromolar pad to the mesial angle of the canine. Encroachment on this line would restrict the tongue space. Arch form teeth arrangement, especially of the maxillary teeth, varies with arch form. 1. Square arch. Arrangement is almost on a straight line with slight curve from canine to canine. There is not much rotation. Full face of all maxillary anteriors should be seen to give a broad effect. 2. Tapering arch. Central incisors are placed much forward than canines. They are also rotated distally. Lateral incisors are also rotated, raised from the occlusal plane, and depressed at the gingival margin. Neck of canine teeth is prominent. 3. Ovoid arch. Arrangement has a definite curvature. Central incisors are set forward of canines, but not as much as in a tapered arch. There is not much rotation. Canines will not be very prominent. Retromolar pad. A line extending from the tip of the lower canine to the upper 2/3 of the retromolar pad determines the height of the lower posterior teeth or occlusal plane. If the occlusal plane is too low, tongue biting. If the occlusal plane is too high, may cause instability and strain, as the tongue struggles to place the food bolus back on the occlusal table. Parotid duct. The maxillary first molar should be placed below the orifice of the parotid gland. Rugae. The labial surface of the canine is normally 10.5 millimeters from the lateral aspect of the first large pair of anterior rugae. Incisive papillae. A line through the incisive papilla and the midline of the raphe determines the midline of the denture teeth. Distance from the middle of the incisive papilla to the labial surface of the maxillary central incisor is typically 8 to 10 millimeters. A line drawn perpendicular to the midline of the palate through the center of the incisive papilla intersects the cusp tips of the canines. In young persons, a line connecting the tips of canines traverses the incisive papilla. With advancing age, due to increased alveolar ridge resorption, the line moves posteriorly and may eventually pass through the distal extent of the papilla. Pterygomaxillary notch, incisive papilla plane tends to be more parallel to the occlusal plane. Nose. The distance between the tips of the canines is the same as the width of the base of the nose. To visualize buccal corridor space, canines are positioned immediately inferior to the side of the nose. Philtrum. The width of the central incisor approximates the width of the philtrum. 2. Dentogenic concept. Sex factor. Feminine characteristic. Softness. Central incisor. For softness, one of the central incisors is moved out at the base. Incisal edges are placed together. Lateral incisor. Lateral incisor is rotated outward with asymmetric long axis between right and left lateral incisors. Masculine characteristic. Boldness and hardness. Central incisor. Incisal edge of one upper central incisor can be brought anteriorly. One central incisor may be bodily placed anterior to the other. Alternatively, the two central incisors can be rotated with their distal surfaces forward, with one incisor depressed at the cervical region, the other depressed incisally. Lateral incisor. Mesial line angle of lateral incisors can be labially overlapped on the distal line angle of central incisors to give feminine characteristics. Mesial line angle of lateral incisor positioned palatally with prominent distal line angle of central incisors depicts male characteristics. Canine. A prominence in the canine tooth. Personality factor. Personality is grouped into 3 categories. Vigorous type, hard, aggressive, muscular. Medium type, normal, robust, healthy. Delicate type, fragile, frail appearance. Vigorous look. Produced by wider central incisors, wearing of central incisors in canine, sharp line and point angles. Delicate look. Produced by rounded contours of the tooth pale color, incisal edge. Young patients, presence of mammillans, cusped point tip. Youthful adult, more incisal wear on central and lateral incisors, and canine, enamel incisal edge of visible depth, bluish hue. Adults, central and lateral incisors abrade in a straight line, cuspids abrade in a curve. This results in flattening of the arch. Erosion seen on the gingival third and neck of the teeth, depicted by careful grinding or polishing with variable shading effects. Diastema, seen very frequently in youth. Denture base, age factor. Youth interdental papillae are freely stippled, pointed, tight against the tooth. Advancing age. Changes include shortening the papillae, raising gingival line, selecting long teeth, contouring the wax, positioning teeth properly to suggest recession. Number 3. Ridge relations. Principles of individual teeth arrangement according to ridge relations in centric occlusion are classified into 1. Teeth relation for class 1 ridge relation, teeth arrangement for class 2 ridge relation, 3. Teeth relation for class 3 ridge relation, teeth arrangement for class 1 ridge relation. Anterior teeth arrangement. Maxillary central incisor. Its long axis inclines slightly towards the vertical axis when viewed from the front. Incisal edge contacts the occlusal plane. Maxillary central incisor slopes labially about 15 degrees when viewed from the side. This angulation is more pronounced in the incisal half of the central incisor. Cervical margin should be within the occlusal rim. Page 168 continues this section onto the next page, so the maxillary central incisor description is incomplete in the supplied images. Teeth arrangement, extracted notes, pages 169 to 174. Maxillary anterior teeth. Maxillary central incisor. When viewed lingually, the central incisor is not straight, but follows the arch form. Maxillary lateral incisor. Long axis slopes more towards the midline than the central incisor. Incisal edge is about 1 millimeter short of the occlusal plane. A mesiobial rotation usually looks good in a female or delicate patient and is called a soft lateral. This makes the tooth look narrower and enlarges the embrasures. For a man or for a more vigorous effect, try a mesiolingual rotation, called a hard lateral. This makes the tooth look wider. Lateral incisors may be placed higher than the centrals, depending on age. This begins the smile line. From the side, it is inclined labially about 20 degrees. Lingual view reveals distal margin overlap of the central incisor by the mesial surface of the lateral incisor due to its inclination. Distal surface of lateral incisor follows the curvature of the arch. Maxillary canine. Long axis is parallel to the vertical axis when viewed from both front and side. Cervical margin of the canine is more prominent than that of central and lateral incisors. It is less prominent in a patient with a square face and more prominent if the face is tapering. Tip of the canine contacts the occlusal plane. From the front, only the mesial slope of the canine is visible. From the side, the bulbous cervical half provides its prominence. From the buccal side, only the distal slope of the canine is visible. On palatal view, arrangement follows the arch form. Teeth are similarly arranged on the opposite side of the rim to complete the maxillary anterior teeth arrangement. Glass plate relation. Cervical margin of the canine is higher than that of central and lateral incisors. Arch symmetry is checked on either side of the midline. Mandibular anteriors. Mandibular central incisor. Long axis inclines slightly towards the vertical axis when viewed from the front. Incisal edge is about 2 millimeters above the occlusal plane. It slopes labially when viewed from the side. Labial inclination is more pronounced in the incisal half of the central incisor. Cervical region remains within the occlusal rim. From incisal view, it follows the arch form. Mandibular lateral incisor. Long axis inclines towards the vertical axis when viewed from the front. Incisal edge is 2 millimeters above the occlusal plane. From the side, it slopes labially but not as steep as the central incisor. From incisal view, it follows the arch form. Mandibular canine. Long axis leans slightly towards the midline when viewed from the front. Cervical margin is more prominent than incisors. Incisal margin is 2 millimeters above the occlusal plane. From lateral view, incisal half of canine is slightly lingually tilted. Cervical half is more prominent when viewed from the side. From incisal view, cusp is slightly more than 2 millimeters above the occlusal plane. Arrangement follows the arch form. Teeth are similarly arranged on the opposite side. Important anterior arrangement points. Incisal edges of all teeth from canine to canine are in the same plane. From incisal view, mandibular incisors follow the arch form. Incisors do not form a straight line, they curve according to the arch. Overjet and overbite are approximately 1 to 2 millimeters in class 1. Canine relationship in class 1, mesial slopes of maxillary canine correspond with distal slopes of mandibular canine. After anterior teeth are completed, the posterior teeth are arranged. Posterior teeth arrangement. Maxillary first premolar, long axis is parallel to the vertical axis when viewed from the front and side. Buccal cusp contacts the occlusal plane. Palatal cusp is slightly above the occlusal plane. Buccal surface of the premolar is in line with the labial surface of the canine. Maxillary second premolar. Long axis is parallel to the vertical axis, similar to the first premolar. Both buccal and palatal cusps contact the occlusal plane. From occlusal view, buccal surfaces of the first and second premolars are in line with the labial surface of the canine. Maxillary first molar. When viewed from the front, long axis slopes buccally. When viewed from the side, long axis slopes distally. Only the mesiopalatal cusp contacts the occlusal plane. Mesiobuccal cusp is close to the occlusal plane. From occlusal view, buccal surfaces of the two premolars and first molar are in line with the labial surface of the canine. Maxillary second molar. From the front, it slopes more buccally than the first molar. From the side, it slopes more distally than the first molar. None of the cusps contacts the occlusal plane. Mesiopalatal cusp is close to the occlusal plane. Mesial surface of the second molar should be in line with the distal surface of the first molar. From occlusal view, buccal surface of the maxillary posterior teeth is in line with the distal slope of the canine, except the distobuccal cusp of the second molar. Completed arrangement gives the required curvature of the maxillary arch. Glass plate relation of maxillary teeth. The glass plate demonstrates the cusp-palatal contact relationship of the arranged maxillary teeth. After arrangement, the maxillary trial denture base is placed on the articulator to verify the correct position of the maxillary central incisor. Beginning of mandibular posterior arrangement. Mandibular first molar. The section starts on page 174. Long axis leans lingually when viewed from the front. Long axis inclines mesially when viewed from the buccal side. The remaining description of the mandibular first molar. Teeth arrangement. Extracted notes. Pages 175 to 179. Mandibular posterior teeth arrangement. Mandibular first molar. All cusps are at a higher level above the occlusal plane than those of the second premolar. Distal cusp is higher when compared with the other cusps. Buccal and distal cusps are higher than the mesial and lingual cusps because of the inclination. Occlusion. Mesiopalatal cusp of maxillary first molar should rest on the central fossa of the mandibular first molar to establish the buccal overjet. Mesiobuccal cusp of maxillary first molar should rest on the buccal groove of the mandibular first molar. This is one of the keys of occlusion. Mandibular second premolar. Long axis is parallel to the vertical plane when viewed from both front and side. Both cusps are about 2 mm above the occlusal plane. It follows the arch form. Occlusion. Buccal cusp tip contacts the mesial marginal ridge of the maxillary second premolar. Mesiolingual ridge contacts the distal slope of the lingual cusp of the maxillary first premolar. Mandibular second molar. Lingual and mesial inclination of the long axis is more than that of the first molar. Inclination of distal and buccal cusps is more than the mesial and lingual. Long axis is parallel to the vertical plane when viewed from the front. It follows the arch form. Lingual cusp is below the horizontal plane. Occlusion. Contact with the maxillary second molar is similar to the occlusion between the first molars. Mandibular first premolar. The mandibular first premolar is finally placed. Buccal cusps, or central groove of mandibular posterior teeth, should coincide with the crest of the residual alveolar ridge. Occlusion. Buccal cusp should contact the mesial marginal ridge of the maxillary first premolar. Remaining mandibular posteriors are arranged similarly on the other quadrant. The central fossae of all posterior teeth are in a straight line on the ridge crest. Completed Class 1 arrangement figures show all teeth following the arch form. Mandibular second molar in occlusion. Mandibular first premolar finally placed. All posterior teeth in a straight line. Completed teeth arrangement. Completed arrangement in occlusion. Key of occlusion. The mesiobuccal cusp of the maxillary first molar rests on the mesiobuccal groove of the mandibular first molar in centric occlusion. This is an important exam point. However, teeth arrangement for Class 2 ridge relation. In Class 2, maxilla is prognathic, or mandible is retrognathic. There is increased overjet of 5 to 6 mm. Same principles of teeth arrangement are followed, with slight modifications. Maxillary anterior teeth. Arrangement principles are similar for both Class 1 and Class 2. They are governed by aesthetics, dentogenic concepts. 2. Mandibular anterior teeth, placed with increased overjet of 5 to 6 mm. Overbite equals 2 mm. 3. Posterior teeth, due to retruded position of the mandibular ridge with less space for teeth. One premolar is removed in the mandibular arch. All teeth are arranged in the maxillary arch. The completed Class 2 arrangement demonstrates the increased horizontal overlap and posterior adaptation. How have teeth arrangement for Class 3 ridge relation? In Class 3, mandible is prognathic, or maxilla is retrognathic. Overjet and overbite are reduced to almost 0.1 mm. Same basic principles of teeth arrangement are followed with slight modifications. Anterior teeth. Arrangement principles remain the same, except that overjet is virtually eliminated. Anterior teeth are arranged almost edge to edge. Overbite is also minimized. Posterior teeth. To provide space for the maxillary posterior teeth, usually one premolar is trimmed mesiodistally or removed from the maxillary arch. The completed arrangement demonstrates a Class 3 ridge relation. Developing balanced occlusion. Once centric balance has been achieved using the basic setting principles, the teeth arrangement is modified to achieve eccentric balance, protrusive balance, lateral balance. For this, it is essential to program the articulator by setting horizontal condylar inclination, HCI, using protrusive records, lateral condylar inclination, LCI, using lateral records, or by using the Hanau formula. Therefore, at least a semi-adjustable articulator is mandatory. Developing balanced occlusion in protrusion. In a protrusive occlusion, anterior teeth are brought edge to edge. This is done by releasing the locking screws and rotating the track forwards or backwards in a semi-adjustable articulator. In working occlusion, contacts should be simultaneously established in the posterior teeth. Factors affecting balance. To achieve protrusive balance, horizontal condylar inclination, HCI, is obtained from the patient and cannot be altered. Incisal guidance should be as flat as aesthetics and phonetics permit, close to 0 degrees. Incisal guidance can therefore be manipulated only to a limited extent. The occlusal plane is governed by anatomical and functional factors. Page 179 continues on to the next page, so the discussion of factors controlling balanced occlusion is incomplete here. Teeth arrangement, extracted notes, pages 180 to 183, developing balanced occlusion in protrusion. Continued. The occlusal plane is governed by anatomical and functional considerations and cannot be altered. The other two factors that can be adjusted to achieve protrusive balance are compensating curves. Cuspal inclination. Cuspal inclination. Cuspal inclination should be less than the condylar inclination. It is predetermined by the selection of artificial teeth. It can also be adjusted to a certain extent by grinding the teeth. Compensating curve. The antero-posterior curve of Spee, influences protrusive balance. During protrusion with anterior teeth in edge-to-edge contact, mesial side of maxillary posteriors is tilted down until contact is made. Distal side of mandibular posteriors is tilted up until contact is made. This creates the compensating curve. The compensating curve is one of the factors in Christensen's phenomenon. Steeper the condylar inclination, steeper should be the compensating curve with low cuspal inclination. This achieves protrusive balance. Care should be taken not to lose centric contact during the process. Developing balanced occlusion in lateral excursions. To achieve lateral balance, working side, buccal cusps of maxillary and mandibular posterior teeth should contact. Non-working, balancing side, mandibular buccal cusps should contact the maxillary palatal cusps of the posterior teeth. Factors. Similar to protrusive balance, LCI is dictated by joint morphology and is obtained from the patient. Therefore, it cannot be altered. Factors that can be modified, compensating curve, cuspal inclination, mediolateral curve, and cuspal inclination are used to achieve lateral balance. Posterior teeth can be tilted buccolingually. Cuspal inclination can be ground to incorporate the compensating curves and thereby achieve lateral balance. Definition. The neutral zone is, open quote, the potential space between the lips and cheeks on one side and the tongue on the other. That area or position where the forces between the tongue and cheeks or lips are equal. Close quote. Importance. A loose and unstable mandibular complete denture is one of the most common and challenging problems faced by the dentist. To overcome this, teeth should be arranged so that forces exerted by the tongue, cheeks, and lips are neutralized. Teeth and polished surfaces of the denture should remain within a zone of equilibrium. If the denture is fabricated outside the neutral zone, instability may occur during swallowing, speech, mastication. The neutral zone technique minimizes the displacing forces of the surrounding oral musculature on the mandibular complete denture. Indications of neutral zone technique. 1. Atrophic mandibular ridge. Denture fabrication after a long period of edentulousness, where tongue, cheeks, lips partially occupy the usual denture space. 3. Enlarged tongue, e.g. Down syndrome. 4. Abnormal anatomy, e.g. hemimandibulectomy. Muscles involved. Muscles of the lower lips, cheeks, tongue are major displacing factors for mandibular denture instability. Important muscles groups involved are 1. Buccinator, 2. Modiolus, 3. Orbicularis oris, and mentalis. Number 1. Buccinator. Buccinator plays a major role in determining the neutral zone. It extends from the pterygomandibular raphe anteriorly. It converges with other muscles at the modiolus. Main function is to position food on the occlusal surfaces of teeth during mastication, in coordination with the tongue. Number 2. Modiolus. Group of muscles converging at the angle of the mouth is known as the modiolus. Includes Orbicularis oris, Buccinator, Risorius, Zygomaticus major, Levator anguli oris, Depressor anguli oris. It plays an important role in positioning of premolar teeth, establishing the contour of the polished denture surface in that region. 3. Orbicularis oris and mentalis. Movement of the lip and tongue helps determine the position of mandibular anterior teeth. If teeth are positioned too labially, lip contraction can cause posterior displacement of the denture. In highly resorbed ridges, the mentalis muscle may displace the neutral zone lingually. 4. Tongue. Tongue is in constant contact with the mandibular denture at rest and during function. It consists of powerful intrinsic and extrinsic muscles. If teeth are positioned too lingually, they encroach on tongue space. Denture may be displaced during function. Polished surface. An appropriately contoured polished surface of the denture is also important for normal tongue movement. Clinical procedure, neutral zone technique. Number 1. Impressions, preliminary impression, made in a stock tray. Uses a mucocompressive impression material, such as impression compound, alginate. Secondary impression, made in a custom-made tray. Uses a low-viscosity mucostatic material, such as zinc oxide eugenol impression paste. Impression should be extended adequately to obtain maximum support, functional depth, and width of sulcus representing muscle activity. Number 2. Jaw relation record. Wax occlusal rims are fabricated using stabilized heat-cured acrylic bases for improved stability. Wire loops can be embedded in the record base to facilitate retention of the rim. Rims are evaluated for extension, comfort, stability. A tentative jaw relation is then recorded. Number 3. Recording the neutral zone. After articulation, wax from the mandibular record base is removed. Vertical projections are fabricated in the premolar region using auto-polymerizing denture-based material. These projections provide occlusal stops at the established vertical dimension of occlusion, support the neutral zone impression material. Projections must be evaluated to ensure they do not interfere with cheeks, lips, or tongue. Various projection designs can be used as long as they satisfy these objectives. Before making the mandibular neutral zone impression, maxillary occlusal rim is inserted. It supports the facial muscles. It allows the tongue to be placed comfortably on the palatal contours during function. Neutral zone impression. Low-fusing impression compound is most commonly used because it can be molded by functional muscle activity. Other materials that may be used include waxes, zinc oxide eugenol, paste, putty impression material, autopolymerizing acrylics, tissue conditioners. Only a minimal quantity of material required to achieve the purpose should be used so that the sulci are not distorted. The material is manipulated by hand and adapted onto the mandibular record base. Functional movements. After the rim is softened, the patient performs functional movements. Smile, pout or purse lips, speak, swallow, slightly protrude the tongue, lick the lips. The material is allowed to set after these movements. After approximately 10 minutes of functional activity, centric record is made. Casts are articulated. Number 4. Arranging artificial teeth in the neutral zone. Neutral zone impression is indexed by placing plaster or silicone putty around the impression material. The index preserves the space of the neutral zone record. Low-fusing compound is then removed from the record base. It is replaced by wax to help set the artificial teeth. Teeth are arranged guided by the index. Posterior teeth may need to be trimmed lingually so they fit within the index space. Polished surfaces of the denture are also contoured to replicate the neutral